Hi, this is Dr. Devin with Spinal Care Nevada, along with my trusted assistants, Carson and Clover. Today, we're going to show you how we help our patients sleep better, reduce pain, and wake up with less fatigue and more energy. If you find this video of help, and I believe it's a game changer, please hit the like button, share it on your own social media, and subscribe to our channel for more great health content. What do you say, buddy? You ready to help these guys sleep like a baby? Better sleep is probably the next big conversation in anti-aging. Believe it or not, while you sleep, your brain not only doesn't shut off, it's working on long-term memory stores, which is one reason that as sleep quality wanes with aging, our memory goes along with it. Hormones such as growth hormone is being kicked out by the pineal gland to help your muscles and your organ system repair. In our office, one of the types of patients we see have fibromyalgia syndrome, and these patients, they get horrible sleep. Eventually, without help, their organs start to shut down too. Your sensory nervous system, or fight and flight, that gets to take a load off while you sleep as well. Without good sleep, it runs 24/7, which can be a cause of heart problems. During REM, or what we call screensaver mode, your muscles actually go into a sort of paralysis, which allows them to take a load off and repair. And possibly the most important event while you're sleeping helps your immune system. Your immune system releases a type of proteins called cytokines. If you're sick or injured, these cytokines help your body fight inflammation, infection, trauma. So without enough sleep, your immune system might not be able to function at its best. While most patients seek us out because they've already tried a number of approaches for their pain or their pinched nerves, many of those same patients complain of sleep problems, ranging from insomnia to sleep breathing disorders such as sleep apnea or snoring. And listen, I don't snore, at least I thought I didn't until my wife Erin showed me the video. Sleep movement disorders such as restless leg syndrome, cramps, or grinding, bruxism of the teeth. All of these things interrupt getting asleep, staying asleep, or feeling like you've got restful sleep. Some patients wake up in pain at night, or some even tell us, hey, I sleep fine, but that their pain is worse in the morning, and it takes them a while to work it out. Listen, I've made such an investigation into good sleep. I give entire lectures and webinars called Sleep Better, Reduce Pain, and Wake Up with Less Fatigue and More Energy. Today, we're going to cover the best and worst sleeping positions. So what's the best pillow and mattress? Research presented on WebMD states that a medium firm mattress is best. But let's be honest, it's definitely an individual choice. My recommendations for best mattresses are all in the links below. And believe me when I say I've done all the research for you and based this on over 20 years of patient feedback. So the first option is actually a two-sided mattress, which allows you to flip and rotate the mattress, which gets the most life out of the product. Smart. Another is a highly reviewed online mattress with a trial period. Lets you test it out, so I like that. And the third option specializes in organic, non-toxic materials safe for infants, toddlers, and of course adults. We'll get more into pillows later, but for now, you can also check out my other video on how to choose the best mattress for you. According to the Harvard School of Medicine, sleep position plays a critical role in musculoskeletal pain. That's pain that you feel all throughout your body. This can create a vicious cycle where pain then disrupts sleep and vice versa. And while the docs at Harvard recommend 2 sleep positions in particular, first I want to cover the one sleep position that's not recommended. The position that will cause the most long-term spinal damage is on your stomach. Now, before you shoot the messenger, I'm going to show you how to most safely sleep on your stomach if that's the only way you can get some Z's, because getting to sleep is the most important thing. So we'll go through a few tips now, but check out our other video on safest ways to survive being a stomach sleeper. According to the Mayo Clinic, and listen guys, I'm a research guy, so everything I tell you has been thoroughly studied. Sleeping on your stomach places a strain on your back and your spine. Here's our friend Ollie, the spine model. Now, as you notice, Ollie has a a curve in the neck, a curve kind of humping out in the upper back, and a curve again forward in the low back. Those are your natural curves, also known as a lordosis in the neck and low back, and a kyphosis in the upper back. They're supposed to be there. They protect all your discs and your nerves. The problem is when the brain sends the nerves down the middle of the spine, the nerves then come out the side. They supply every muscle, cell, organ in your entire body. So when your neck is twisted at night because you're sleeping on your stomach, what it ends up doing is pinching the nerves. In other words, twisting your neck can cause a pinched nerve. The cervical spine is one of the areas that I know the most about. It's the number one thing we see in our office. Neck pain, pinched nerves down the hands and arms, then followed up by back pain and pinched nerves down into the legs. We use several fairly unique forms and very gentle forms of modern chiropractic, NUCA and arthrostim. We're not going to get into that today. You can look it up on drdevin.com. But the NUCA adjustment gently adjusts the top bone in the neck, known as the atlas. The atlas bone surrounds the lower portion of the brainstem. Now, researchers, they don't fully understand how the sleep process works, but they know enough to recognize that the role of the brainstem is critical in regulating our internal clock, called a circadian rhythm. So getting this area adjusted will get your head on straight and help everything else underneath it. The second tool we use is called an arthrostim. The kids in the office nickname it the woodpecker. And that's how we reduce pain in the neck, mid-back, and low back by getting pressure off those discs and off the nerves. This also helps us improve posture. I was just reading on the Johns Hopkins Medicine website the role of posture in better sleep. In fact, the National Sleep Foundation says that nearly 1/3 of people who've undergone chiropractic adjustment say that they experience an immediate improvement in sleep. So, a few tips to help you sleep on your stomach. There are specific pillows that allow you to sleep on your stomach without turning your head either way. Those links are below. But without that special pillow, try to share the load throughout the night and spend some time with your head turned to one side as well as to the other. Now, if you find that it's painful turning your head one way or the other, or the range of motion is less, that's a critical sign of an underlying subluxation. Subluxation is a term you'll hear a lot around our office. That's where the bone in the neck is misaligned, and it may be pinching a nerve. Subluxation is what we in the office both detect and correct. Place a supportive pillow underneath your lower legs when you're on your stomach. This slight bend will help keep that curve in the back. Can I borrow that? Thanks. And it'll look something like this. Or you can place a pillow underneath your pelvis, which will also help you maintain that curve in the lower part of your back. Hey, that's my hair! Okay, the two highly recommended positions to sleep on from Harvard. Number one is your side, and the other one is your back. Let's talk about sleeping on the side first. You're going to create a pillow palace. There's no perfect pillow. I really like this pillow, which the link is below, because it's got shredded memory foam in it, so you can shape it different ways. When you're sleeping on your side, the most important thing is neutral spine, so that your head is not tilted one way or the other. This will also help you with hip and knee problems. Now think about this. When you're standing, your legs are about hip or shoulder width apart, but when you're sleeping on your side, they compress together. So you need a spacer in there, which is a pillow. So when women are pregnant, doctors recommend they put a pillow in there, but it's good for everybody, guys and women. Okay, so I've got a few different pillows. This is just a simple couch pillow. And what we're going to do is get into a side lying position with a pillow underneath my arms as well, which keeps my shoulders from rolling together. And bulking up this pillow underneath my head keeps it in a neutral position. So I've got a pillow in between my knees. Are you blocking the way again? And a pillow in front of me. This pillow in front of me also prevents me from rolling too far forward or backward and creating a twist in my spine. This is the perfect position to sleep on your side. Okay, so that was the perfect sleeping position when on your side. When you get sick of that, then you need to roll to your back. Now, patients with breathing problems tend to have more of an incline underneath their upper back, those adjustable beds that raise your legs and raise your upper back are great too. We see a lot of patients with pinched nerves in the low back like sciatica, herniated discs, low back pain. So sleeping in this position generally takes the most pressure off. 1, 2, 3. Some of our patients take a rolled up towel and actually slide it underneath their sheet. And that gives them a permanent way to keep a pillow underneath their knees, just like that. That little bend in the knees helps you maintain the curve in the low back, so it takes a lot of pressure off. For those of our patients who have sciatica or severe low back pain, use even more pillows like this. That helps you raise your legs up a little higher and keep pressure off the low back. Now you notice the pillow underneath my head gets a little bit flatter because, again, you don't want your head cranked up into your chest. That will affect your breathing as well. So this is the safest position in your low back. Some people still put a little roll underneath their low back. And when I've had patients, for example, who've had shoulder surgery, they can only sleep on their back. Their low backs tend to get better. What do you think about that? Pretty good? A portion of the proceeds from the product links below go to the Humane Society for the protection of animals. Clover was a rescue dog. Someone turned her in at 3 months old because she had a bad leg. And guess what? She still has a bad leg, but we do everything we can for her and animals just like her to have the best life they can. So if this video helped you, join us in helping others. Please hit the like button, share it on your own social media, and subscribe to our channel for more great health content. This has been Dr. Devin and Clover with Spinal Care of Nevada. Hope you have a rocking day.